It's a robust enough measure for a study that's like this.
So it's a robust enough measure for a study like this. I mean, I guess I contrast that with saying that a clinician or a dietitian who is dealing with an individual person, they have to pay attention to a lot of things. When we start looking at populations, there may be some differences, but the power of comparability is so much that our view, our collaborators' view, was that the best way to look at this is to actually use the same measure and similar ways of classifying it for the whole world.
And now that you've got all this data, what can individuals and countries do with it? Can it help us somehow to halt this growing obesity epidemic that you're seeing in some places?
Both underweight and obesity are about shortage and absence and unaffordability of healthy food. And that's increasingly a global phenomenon with the rising cost of food and cost of living, especially as we have been coming out of the pandemic and the war in Ukraine. There is also specific programs that people can take on. So a clear example of this, which applies to children, to adolescents, to young people, is healthy school meals, whether it's universal or whether it's targeted to those of lower income, is a particular national decision to be made. They have been shown to be very effective in nutrition and healthy school meals. Other programs to use social assistance and food assistance to actually incentivize healthy eating. So there are things that governments can do today that doesn't have to wait as we deal with poverty and cost of food issues. So on the other side of this is obviously we should be increasing regulation and when relevant taxes on unhealthy foods. So both restricting and limiting and making it difficult to use the bad things and especially making it affordable and accessible to eat the good things.
Professor Majid Ezati. Now, here, as a family doctor, I'd love to get your perspective on these figures. Were you surprised to see them?
No, not really. And I think what I loved about that package was that it is a malnutrition problem, you know, and I think many years ago we would have thought of obesity as a calories in and calories out type problem, and clearly it's not. It's about the quality of food. And also what I would say in the consulting room, you know, there are so many factors that affect weight. It's not just diet, there's also exercise, there's stress, the state of your gut microbes, sleep, you know, all sorts of habits. And of course we know about the dangers of ultra-processed food, and I think that's got a massive part to play. So what I'd be interested to know is that in those countries where it's not such a problem now, so there are less underweight people, whether they are actually healthier because their weight has gone up, or whether it's because they're eating, say, more ultra-processed foods, which is making their weight go up. Because, of course, we know that malnutrition can lead to obesity, as well as making people underweight if they don't have the caloric intake that they need.
And how hard a problem is this to tackle when people can't always have a lot of choice about what kind of food is available?
Look, I totally understand, you know, and actually without